The Dolores Huerta Foundation, in partnership with Building Healthy Communities, established the COVID-19 Coalition, a coalition of community-based organizations, government agencies, to bring vaccination access to our communities of farm working, low income, and rural individuals.
We knew from experience that asking our community, our residents, to go to the Department of Health wasn't going to be something they're comfortable with. So that's why we created clinics. We went to parks, we went to halls, we went to wherever there was space made for us. We even went to McFarland Recreation Center and let the community know it's going to be us. The trusted messengers are going to be there.
Our approach was not only communication strategies, but it was actually door-to-door canvassing.
Because a lot of the communities lack resources, and having vaccine clinics in these communities made it easier for residents to come and get vaccinated and get resources, of course.
We concentrated in those areas where farm workers would live, and we knew there was a need.
Our team of canvassers were able to build trust with the community members, and the community members were able to share their stories that highlighted their multi-issue barriers to vaccination access and allowed our team to address those barriers.
Farm workers usually work from 5 a.m. till 3, 4, 5 p.m. They have no access to open clinics. Probably at that time they're closed by then. Farm workers usually are the last ones to get the information, and they usually get the wrong message. When they're working in the crew, people talk and they have the wrong information. So it was extremely important to have vaccine clinics after hours, after 5 p.m., during the weekends. Most of the people in the communities, farm workers, low income, that's how they get the word out, by word by mouth.
If a resident comes, it's just not going to be me. They're going to bring also their family. So what else should we provide? If they're going to be for this period of time, can we have someone donate some food? Maybe have a food truck or that type of thing. So again, making it as comfortable as possible.
During one of the vaccine clinics, Comunidades Aliadas has a resource table with different brochures from various agencies. There's this one farm worker woman who came up to our table, and I shared a resource with her. She had a baby in a stroller. The baby was facing away from me, and without knowing, I shared this resource with the lady, and I tell her, if you know anyone that might need these services, this agency in Bakersfield helps families with children that have autism or Down syndrome. The lady's face seems so excited, and she goes, me. And she turns the baby around, and her baby has Down syndrome. And she's a tiny baby, and the farm worker woman shared that if it was not for this vaccine clinic and agencies, she would have never found that resource. And she was very excited and thankful for this resource because she was going to make the call to get help for her young baby.
We're lucky enough to, again, have really good relationship with the rural communities around us that we can find a space. We can have DHF is great at doing door-to-door and their outreach and their network. BHC also has different relationships with different partners and with the city and with the county. The Department of Health was really great at saying yes to us. Again, just remembering we're all together.
Through co-locating clinics, we were able to bring these clinics and bring different resources such as emergency food baskets, hot meals, gift cards, transportation, and much more. to ensure that we maximize the reach in our communities.
During COVID, everyone was able to stay home, but our essential workers were still out in the fields. But were we thinking of what their needs were? We didn't. We were thinking about what they can provide for us. So again, as partners saw there was a need.
We created opportunities and resources to provide transportation, to provide gift cards that compensate our community members for their time, for the transportation, for the emergency food baskets, and much more.
You know how to pivot. Okay, this is not working. Let's stop. What do we need to do? How quickly can we do it? Who's able to do what? And we didn't like to say, we can't do this. That's one of the things that we're like, how else? If we can't do this, what else can we do to make this happen? Or if not, how do we bring what is needed to the residents, to the communities?
It is important to be patient with our community members. When we talk about meeting community members where they are, it means to really listen to where they are, also in life. It is important to speak with them multiple times and provide that ongoing communication, the information to reach us when they're ready.
That's why it is important meeting communities where they're at and co-locating with other services. We established the vaccine clinics not only to support communities, but also to provide other services. It was not only about administrating shots. It was about providing access. It was about fostering trust, and most important, ensuring equity in healthcare. So by coming together and offering these services, we're not only protecting individuals, but also establishing the fabric of our communities and paving the way for a healthier, more resilient future.